Have you ever noticed how one word can make almost anything sound harmless? Routine. Routine blood work. Routine checkup. Routine surgery. But routine for whom? What seems simple for a healthy 45-year-old can become a very different experience for someone over 70 living with diabetes, high blood pressure, or arthritis. I've watched families walk into the hospital expecting a quick recovery, only to spend weeks wondering why their loved one never seemed quite the same afterward. Not because the surgeon made a mistake, but because no one explained how differently an aging body responds to the stress of surgery. Today, we're going to uncover 5 procedures that deserve a much deeper conversation before anyone over 65 agrees to them. This isn't about creating fear. It's about making one of the biggest medical decisions of your life with confidence, realistic expectations, and all the facts you deserve to know. Several years ago, I met a retired school principal named Margaret. She was 74, independent, sharp, and still drove herself to volunteer twice a week. Her biggest complaint wasn't serious illness. It was shoulder pain that made gardening, the hobby she loved most, increasingly difficult. Her orthopedic consultation lasted less than 20 minutes. The surgeon explained that shoulder replacement surgery had excellent success rates and would improve her quality of life. Feeling reassured, Margaret agreed. The operation itself went exactly as planned, and from a surgical standpoint, everything was considered successful. But recovery wasn't what anyone expected. The anesthesia lingered longer than predicted. Her appetite disappeared. She became confused while in the hospital, and weeks of inactivity weakened muscles she had spent decades building. Instead of returning to her garden within months, recovery stretched far longer. Nearly a full year passed before Margaret finally felt like herself again. Looking back, she told me something I've never forgotten. I prepared for the surgery, but nobody prepared me for the recovery. That single sentence has stayed with me ever since because it captures what so many older adults experience. My name is Dr. Kevin Attewell. I've spent more than 20 years caring for patients before, during, and after major operations. During that time, I've learned something every older adult deserves to hear. The operation itself is often only one small part of the journey. Recovery is what truly determines whether surgery improves someone's life. And recovery becomes much more complex as we age. Not because older people are weak, but because every organ system has fewer reserves than it once did, making it harder for the body to recover from major stress. Imagine your body as a beautiful home that stood strong for 70 years. The foundation is solid. The plumbing still works. The electrical system functions. But if you suddenly remodel the entire house, every system is placed under tremendous stress all at the same time. Surgery works much the same way. Even when everything goes perfectly, your body must repair tissue, fight inflammation, regulate blood pressure, process medications, restore strength, and protect itself from infection, all simultaneously. That's an enormous workload for any body, especially one that's been aging for decades. In younger adults, these systems often bounce back quickly. In older adults, recovery usually takes much more time, patience, and support. That's why 2 people can undergo exactly the same operation with the same surgeon, yet experience completely different recoveries and long-term outcomes. Now let me be absolutely clear. I'm not telling you to avoid surgery. Many operations save lives, restore mobility, relieve pain, and dramatically improve quality of life. The purpose of today's discussion isn't to convince you to say no. It's to help you ask better questions before saying yes. Sometimes surgery truly is the best answer. Other times, another treatment deserves consideration first. Knowing the difference can change everything. Let's begin with the first procedure, one that many older adults believe is the only solution once shoulder pain starts interfering with everyday life. Many people assume shoulder replacement is the obvious next step once pain begins limiting daily activities. Sometimes that's true, but not always. Shoulder arthritis often progresses slowly, and for many older adults, pain comes and goes depending on activity, posture, inflammation, and muscle strength. Replacing the shoulder joint is a major operation. Muscles must be detached, bone surfaces removed, and artificial components carefully implanted. Recovery isn't measured in days or even weeks. It often requires several months of dedicated physical therapy before strength and movement begin returning. The hidden challenge isn't simply healing the incision. It's rebuilding strength while avoiding stiffness that can permanently limit motion. Some older patients continue experiencing discomfort or reduced mobility long after surgery, especially if rehabilitation is delayed, interrupted, or becomes too physically demanding. I've seen patients become discouraged because they expected immediate relief. Instead, they discovered that recovery required daily exercises for months. For someone already managing heart disease, balance problems, or chronic fatigue, that commitment can quickly become overwhelming and much harder than anticipated. Before deciding on shoulder replacement, ask whether targeted physical therapy, anti-inflammatory treatment, guided injections, or simple activity modifications could control your symptoms first. Sometimes strengthening the muscles around the joint can delay surgery for years, and sometimes that's exactly the right decision. The next procedure surprises many people. The carotid arteries carry blood to your brain. When testing reveals narrowing, it's natural to think the blockage should be removed immediately. But modern medicine has changed, and today's recommendations aren't always the same as they were years ago. Specialists now understand that not every narrowed artery behaves the same way. Many people with moderate narrowing never develop symptoms. At the same time, surgery carries its own risks, including stroke, bleeding, heart complications, and temporary nerve injuries that can affect swallowing or speech. Whether surgery is beneficial depends on your age, your overall health, and whether you've already experienced warning signs like a transient ischemic attack. For carefully selected patients, surgery can reduce future stroke risk. But for others, modern medical treatment may provide excellent protection without immediate surgery. That medical approach often includes controlling cholesterol, managing blood pressure, quitting smoking, and taking appropriate blood-thinning medications. So the most important question isn't simply, is my artery narrowed? It's, will surgery improve my outcome more than today's medical treatments? That's a conversation every patient deserves to have. Now let's move to another operation that's increasingly common as we age: hernia repair. While repairing a hernia often sounds like the obvious choice, repeat surgery can sometimes become much more complicated than people expect. Scar tissue from previous operations changes the anatomy, making repeat hernia surgery more challenging. The procedure may take longer, recovery can be more uncomfortable, and despite another operation, the risk of the hernia returning may still remain significant for some patients. I've spoken with patients whose biggest concern wasn't the hernia itself. It was the fear that another surgery would leave them feeling weaker than before. For small hernias causing few symptoms, careful monitoring may sometimes be a reasonable option instead of rushing into another procedure. Not forever, but until the benefits of surgery clearly outweigh the risks. The key lesson is simple. Not every hernia requires immediate action. Sometimes careful observation, regular follow-up, and informed decision-making can be just as important as the operation itself.